And I want to welcome everyone to our weekly coronavirus information session. I want to start today by just giving you some best practices first. So make sure that you keep your mic off during the time. Keep your video off if you do not want to be videotaped, but otherwise it would be lovely to see your face. If you have a question, you can type that in the chat, and then Justin will work us through all the questions. We want to make sure that you know that you can call the Kentucky COVID hotline at 800-722-5725. If you have any concerns about your health, you can also call us directly at the clinic at 588-4340. And then if you have any difficulties with your sound, please just follow the instructions that you can see there on the screen by testing the sound using the little up arrow there. And then lastly, I want you to just in the chat, type in the name of the county that you come from or that you work in. You can do that anytime during the session. So that's just the housekeeping, but I want to start today a little bit different. And I want to start our session by asking for a minute of silence to honor the more than 100,000 people who lost their lives due to COVID-19 in the US. Also, I want us to reflect on the bigger discussions going on in our society today. I want us to reflect on what we need to do to allow our fellow human beings to breathe freely. We will do this with 1 minute of silence to reflect on our own breath and how we can allow others in our society to breathe as well. So I'm asking Joe to ring the 3 bells, and we're going to start our minute of silent reflection, and then he will let us come back. Thanks, everyone. I appreciate it. And welcome to this session. I am now going to ask for our weekly update from Dr. Furman, our medical director, before I introduce our speaker for today.
Yes, I'm Christian Furman. I'm the medical director here at the Traeger Institute, and thank you, Anneke and Joe and everybody for that moment of silence. I think we all needed it. So I want to start by giving you the updated visitation policy for U of L Hospital. Each hospital is having its own visitation policy, and they've all changed a little bit, but this is University of Louisville Health. So U of L Health includes, Jewish Hospital, U of L Hospital, Mary and Elizabeth Hospital, Peace Hospital, and all the outpatient testing sites. But it used to be there was 0 visitation. Now they've changed. This was effective May 27th. There's 1 visitor at a time now, and visitation is from 10 a.m. to 7 p.m. And visitors have to stay in the patient's room. They can't just wander the halls. The waiting rooms are closed. The visitors must successfully complete a health screening. So they're not going to let you in if you have a fever, cough, shortness of breath, chills, muscle aches, loss of taste or smell, mental status changes. And if you have any COVID symptoms, they're not going to let you in. You have to wear a mask. They're asking you to bring your own mask. If you don't have your own mask, they'll supply one. You have to wash your hands upon entering and exiting the facility and the patient's room. Let's see, I'm scrolling down here. No visitors will be allowed for adult patients who have a pending or positive COVID-19 test. And pretty much they're testing everybody in the hospital. So, people go in through the emergency room, and people are going to have a pending test if they're in the emergency room. You know, Dr. Joe gave us an example of the emergency room, and there's different policies in the emergency room. So they're still, waiting rooms are closed. They're asking everybody to leave a phone number and wait in the car when you drop off somebody in the emergency room, because they are testing everybody. So everybody's going to have a pending COVID test right away. So that kind of explains what's going on at U of L. Like I said, each health system is a little bit different, so check with your health system. But I think a lot of people were not wanting to go to the hospital because they're afraid they weren't going to be able to have any visitors. And now they can have visitors. So that's really changed things a lot, especially, you know, they always made an exception for end of life care, but it was always tricky. Like, you know, when does end of life care start? And so now people can have visitors in the hospital. So that's a huge change, and that's really helped everybody. And if you need to go to the hospital, please go to the hospital. People were delaying care and having MIs at home, having strokes at home, and it was not good. So hopefully this change in the visitation policies allowed people to kind of just get back to normal, going to the hospital if they need to go to the hospital. I want to just remind everybody that the same policies, even though we're doing healthy at home and things are opening up a little bit and stores are opening up a little bit, and they have plans for Kentucky Kingdom and plans for the pools and all kinds of stuff, the guidelines are all the same, which is hands, face, space. So hands means, you know, wash your hands for 20 seconds with soap and water anytime you touch anything, or sanitize them with an alcohol-based solution anytime you touch anything. Do not, you know, face, wear a mask. The mask needs to cover your nose and your mouth. Don't wear it around your neck. If you want to take it off to eat, bring a, you know, paper sack and put it in the paper sack, because the whole point is to keep it from being contaminated. And also that face part is don't touch your face. That's where the virus gets in. So if you touch your mask, then don't touch your face. You need to sanitize every time you touch your mask. And then space, you need to give 6 feet between you and other people. So at work, every once in a while, people have to drift closer. And that's why, you know, we make sure we always have a mask on, and people just, you think you're going to be 6 feet apart. You're going to go out with your friends. You're going to stay 6 feet apart, but people drift. You can't, it's kind of like driving. You can't be, other people do stuff. You have to be like a defensive driver and be aware of the other person, where you can't be in charge of everybody around you. You don't know when they're going to come in closer than 6 feet. So you always have to wear your mask and stay 6 feet away from people and back up and give distance. I think they said in some schools in Europe, maybe even that, they're wearing hula hoops around the kids, so they're staying 6 feet apart. So, you know, maybe wear a hula hoop and stay 6 feet apart. So that's the big thing. The other thing, if you've been exposed, each health system, each employer has a different policy about when you can return to work if you've been exposed, but a lot of them are just going by symptoms. So if you've been exposed to someone, you have to monitor for symptoms. You know, twice a day, they recommend taking your temperature, kind of taking a self-check. Do I have a fever, cough, shortness of breath, chills, muscle aches, loss of taste or smell? And then the other big thing, I wanted to give an update about just the nursing homes in general. You know, throughout the state, the governor's mandated every nursing home be tested, the patients and, well, the residents that live there and the staff. So my nursing home is Presbyterian Home, and we were tested on Friday, and it really went very smoothly. Norton's has supplied a lot of the staff to do the testing, and then the actual tests are going to I think it's called Gravity Labs, and we just do the swabs, you know, put them in a mailing container and we mail it to them, and we got the results over the weekend. And 4 residents came back positive, 3 in the nursing home side, 1 in the personal care side, and 4 staff came back positive. I think 2 were CNAs, 1 was a PRN nurse, and 1 was dietary. And all those people are asymptomatic, so nobody had symptoms. So that just kind of shows that, you know, that's the asymptomatic people that carry it and then spread it, and then it can go like wildfire through nursing homes. So I think it's really smart that the governor is testing everybody, and then we're able to isolate those people, and then what we'll do is retest, and then we retest in 10 days. I know Episcopal was tested, and they, as last I heard, did not have any positive. But, you know, about a week ago is when, and I don't think we talked about it at this call last week, because I didn't really know until that afternoon, but Memorial Day weekend is when the results came back over the weekend for Nazareth at Clifton. It used to be called Sacred Heart. and they had like 38 people come back positive. This patients and the staff, I can't remember how many. And same thing happened at Trayton Towers. It's just there wasn't enough staff to take care of the patients because all the staff were sick too. So they were those positive patients were sent to about 6 different nursing homes, and it's really hard on the nursing homes because they don't want their patients to leave the nursing home. That's their home. But, you know, it's just a staffing issue. There's not enough staff to take care of them. So we haven't finished getting through all the nursing homes in the state, but that is happening, and it's a good thing. And then also just the governor's press conference, you know, it's been every day at 5 o'clock, and he made an announcement last week that would change to Monday, Tuesday, Wednesday, Thursday at 4 p.m. And so to be determined. If yesterday his conference was at 5:30, so we'll just kind of have to keep an eye on when it's going to happen today. But you know, you can always check his press conference for more up-to-date details throughout the week. And then I'll stay on for questions if there's other questions or things. We'll take those at the end.
Thank you, Dr. Furman. So now it's my honor to introduce you to Stacy Roof. She is the president and CEO of the Kentucky Restaurant Association. And she's going to talk to us a little bit about the fact that restaurants are up for the reopening challenge. And I just want to give you a small bio. She joined the Kentucky Restaurant Association in February of 1995 as an administrative assistant. And the association's board of directors unanimously appointed her as president and CEO of the statewide organization in 2000. She holds a BA in Communications, Public Relations from the University of Louisville, and has an extensive background working with small businesses as well as larger corporations. She has served on the Council of State Restaurant Association's Board of Directors. She currently serves on the University of Louisville School of Public Health and Information Sciences Community Advisory Board. She's been married to Douglas for 29 years, and she's 3 children, 18-year-old Ellen and 15-year-old twin boys, Solomon and Galloway. They reside in Louisville. Welcome, Stacy, and we are ready to listen to you.
Thank you. I appreciate it. We had a birthday cake this morning for breakfast in my office, and there was a cardinal on top of it, a Louisville card. So I'm a proud card and love my university. I love all of our state universities, but I have a special place for my alma mater. So thank you all for having me. I don't know what I can tell you all that you probably don't already know. So I'm just going to kind of talk around what's going on in restaurants in terms of them reopening and how that kind of fits with public health and all the things that they've got in place, I guess, to monitor that. And so a tiny bit of history. We were all kind of thrown into this situation that we really, 4 months ago had no idea that 2020 was going to look like this for us. Our restaurants are no different. And, many businesses really have had to adapt and figure out how they can continue and how they can survive, right, with all that's going on. So restaurants in particular, I think, are interesting because we are already highly regulated, and we've got health inspectors in and out of our places at a minimum of twice a year, usually more often than that, just looking for all the minimum requirements that restaurants have to meet on an everyday basis. And so I always say that really, aside from healthcare facilities and places probably like nursing homes, there is no cleaner place that you can be because it is so regulated and it is so tightly watched. The standards are super high. There are all kinds of trainings around what they need to do, how they need to meet those standards. And I'm going to talk a little bit about that in a second. But when all of this started, we were surprised to be shut down on March 16th because we didn't think the day before when the governor made his comments that was going to be the case. So, you can't just turn a light off and leave a restaurant, right? There are a lot of things that go into that. You've got food that's on the premises. You've got, people that you have to take care of and figure out what are they going to do in the interim. And there are just a lot of processes that happen on an everyday basis that, you need to go through some protocols when you close. So over the next few days, those things happened. And then most operators decided pretty quickly whether they were going to try and stay open for curbside and carry out and delivery, or for some finer dining places that really didn't have much of that business already, they just said, we're going to stay closed for the foreseeable future until we figure out what this looks like. So for the most part, if a restaurant has a drive-through or had already established a carry-out or delivery business, they were in much better shape than those businesses that had not, really been effective at those or didn't have that opportunity, because customers still had multiple ways to get that food if they wanted it, if they wanted to keep some semblance of that normalcy. So restaurant meals now, I think they make up 51% of all meals that the general population eats on a regular basis. So we always used to say, less than half. Now it's more than half of the meals that most of us consume on a regular basis come from a restaurant in some format. And so, it's not just a luxury. It's not just something that's nice from time to time, although most of us would say those things. But it really is, in a lot of places, a necessity and an option that just needs to be, available to a lot of people. So a lot of our operators, even if they temporarily closed, kind of opened back up and tried to build up that carry-out business and all of that. All that to say that just because you're not operating at the same level you were previously doesn't mean that any of your sanitation or hygiene or health practices go away, right? In fact, everything had to be stepped up because it was scrutinized, and standards were not just the national standard that we all adhere to and the training that we learn, but also everybody now is looking at it through that lens, right? When you go through a drive-through, does the person have gloves on? Do they have a mask on? You're kind of looking in the kitchen. Do things look different? And so I think for the most part, from our perspective, things haven't changed all that much. They just look different, right? Visually, it's different to a diner when you walk into a restaurant. Now we're able to do that. We're a week and a half into our 33% capacity opening of dining rooms and patios. And I think if we close our eyes, things feel pretty similar. It might not be quite as noisy in some places as we're used to, with a lot of closer tables and people chattering and everything and laughing. But really, if you close your eyes, it's the same experience, and a lot of the things that restaurants do all the time in terms of sanitation and practices are things that we don't see or notice, right? I mean, we might notice going to the restroom and it looks like ransacked because it's been a really busy, and it's a late night or something. But for the most part, all of those things take place whether we notice them or not. And so I think a lot of what we're seeing now is just that. It's visual things that we've noticed. So the national program that we train our members through, and the health department recognizes, even though they do their own training for restaurants, is called Servsafe. And that is like I said, it's a national certification program. It is a really in-depth, comprehensive look at everything under a restaurant's hood or roof, if you will. And it takes people through everything from bacteria and microorganisms and all of the things that we're trying to kill when we clean and sanitize, to the facilities and the processes within those facilities, obviously through food and cooking and cooling and storing all of those products that are in that restaurant. So most of what we submitted to the governor's office when we were asked, as most businesses or trade groups were asked to do, to submit a proposal for what the guidance would look like once we were allowed to reopen, was based on, our guidance was based a lot on Servsafe practices and those national CDC recommendations and the Conference for Food Protection and university public health experts and their best advice. our document really wasn't taken, there's nothing in the Healthy at Work restaurant reopening language that was taken from our document, but a lot of it is very similar in its wording, right? Just touching on some of those things under cleaning and disinfecting. Obviously, these are things that happen all the time, but now I think rather than this is our cleaning and sanitizing schedule that always happened, there are more intervals, right, of checking. And rather than we're going to clean and sanitize every booth or every menu, X times a day, now it's between every customer visit, right? And if someone comes into contact with the surface, it's going to be cleaned and sanitized. And if you've been in any restaurants in the past week and a half, you'll see that one person usually in every restaurant is designated to kind of walk around with the spray or the wipes and just kind of patrol and wipe all those surfaces after customers have been there. And as other customers are dining. And I think there's a little bit of a comfort in seeing that now, right? Because we're all armed with those things, even in our homes and our offices and stuff. So these requirements that Healthy at Work came out with for our state guidelines goes through all of the things, as I said, that restaurants do all the time. It just asks that those frequently high touch items get sanitized more often. Also goes through, dealing with workstations and dealing with payments and trying to become as contactless as possible in those situations. And so you might go to a restaurant and that might look like a menu. They ask you to pull up their menu on your phone, or they bring you a tablet, or they say, here, I went to a restaurant, I went to Wild Eggs that first Friday that we were open, and there was a card on each table with a scan. You could scan a code and the menu would pop up along with their policies, right? This is what we're doing in our restaurant. These are our policies. Please wear your mask while you're not consuming food, or, if you get up from your table, please keep your mask on, those kinds of things. Also things that they've gone over, cleaning and sanitizing equipment that is in the restaurant, not necessarily in the kitchen, because obviously cleaning and sanitizing happens constantly in the kitchen, right? Anytime you'll walk in now and you'll see hand sanitizer and or wipes at different stations around, right, that you can usually get as a customer, and those are all good things too. And some people are even, of course, we're still bringing our own, right, kind of wiping our surfaces. And I know my husband keeps, I tease him, he's like a little old lady. He's got his little Ziploc bag and his wipes in his Ziploc bag, like in his pocket. And so, he's just very aware of keeping his hands clean and wiping things down. Also, some of the things that you'll see too are, we have to have signage posted kind of explaining, don't come in, and this is standard, this is every business. If you've got symptoms of COVID, if you've been exposed to someone with COVID, and then businesses have to have some kind of practices or policy established if an employee shows up and they take their temperature, and businesses are doing that. And what happens if that person's temperature is over 100.4? What's the policy? Where do we send them? Do we send them to the primary care doctor? Do we have somebody we recommend they go see? What's that practice or policy look like? So those are kind of all new things, to the restaurant world, because we've never really been in this situation. I think it's been 100 years since something like this has happened to this extent. And it's not a foodborne illness, right? So it's nothing that we can precaution against or cook out of a food product. It's not transmitted that way. So, and because our officials really don't know a lot about it and are learning all the time, it's just really interesting. I was listening to Dr. Klein with U of L on the radio this morning. He was on 93.9. That's where I get my U of L sports information usually. Of course, right now we're all starved for that because we haven't had any. But he was talking about just the difference in what they're finding about, COVID outside exposure, outside and inside, and how you're less likely to contract it. They're finding if you're outside in the elements than inside in a building, where you're closer to people and the airflow isn't what it usually is. So, it's just so many different things that nobody can really explain yet, but they're learning, I guess, step by step. A couple of other things that I guess I'll mention. We're all social distancing, but one of the things that restaurants are asked to do is to seat people. They can seat up to 10 people together, but they're supposed to be from the same household, right? It's hard to ascertain that. I don't know how many people are telling the truth if they're asked that question. And then those are inside requirements. Outside, distancing has to take place, but there really aren't limits on how many people can be outside, right? They just have to be spaced accordingly. I don't know what else to kind of comment on. I'll say a couple of things about what Dr. Larry Lynch, who is a senior vice president with the National Restaurant Association, he's kind of the Servsafe guru and has been the one most quoted in the national news. And his quote is that really the back of the house, which to restaurants is kitchens, right? That's where the work happens that you don't see. The back of the house hasn't changed at all, really, other than, there's probably facial coverings on those workers in the kitchen. It's the front of the house and that visual comment that I made earlier that really kind of looks different. You might notice things like a restaurant recommends reservations that's never recommended reservations because they're trying to monitor numbers and things, and they'll ask you, make a reservation, call us when you get here. We may ask you to stay in your car for 10 minutes. We may bring you in right away, and we'll just kind of monitor numbers that way. We talked about hand sanitizer. We talked about some facial coverings that most people are asked, well, in the restaurant they're supposed to have on, but diners can be asked to keep those on other than when they're eating. And restaurants just have to come up with those policies. It's uncomfortable for someone in hospitality to chastise someone sitting at a table. If they're not up and moving around, it's hard for them. Goes against every fiber in their being to not be welcoming and hospitable, right? And to say, and kind of smack them on the hand. You've got to put your mask on, right? So that's just something we are all going to have to, I think, get used to. We're going to lose some of the face-to-face. I think it's really hard when you've got facial coverings on to not really get to take someone's temperature by the face that they're making, right? We communicate so much through our smiles and through, just faces that we can make, and you can just really convey your feelings and really that hospitality, that unspoken hospitality through your mannerisms. And so it's hard when all of that's kind of masked to not be able to do that. So, I'm happy to answer questions. I don't know how technical you all want to get. I've talked a little bit about some of the requirements that restaurants are asked to adhere to. Do you have questions that I can answer, or do I need to look over at the chat and go from those?
No, that's the questions. I'm going to start with the question about social distancing, and then Justin is going to take it from there. So there are two questions in the chat related to social distancing, and I posed the first one, and it had to do with a blog that Courier Journal reporter wrote about the first Friday the restaurants were open, and she and her husband went to eat out, and was really surprised by how the restaurants are not supporting social distancing rules. And then there's also another one who posted that says, I've already seen restaurants in different parts of the state, including locally, who have not adhered to the social distancing policies as well as the mask requirements. I won't eat there, but should they be reported, and what are the consequences? So those questions that makes it bad for some of us to go back. Do you have any response to that?
Well, I think that it's hard to control people, and you can post your policy until the cows come home, and people are going to do what they're going to do. I think a lot of what reporters have cited noticing has been outside. I drove by fill in the blank in the Highlands, and people were grouped together on the patio. Probably not all from the same household, but who knows? And it's just hard to police that, especially and particularly if it's outside and you're not in the dining room, right? And we don't have those, they've gone to great extents to try and space those tables accordingly and allow for chairs and things. And so, I don't know, it's really a hard thing to police. I picked up dinner last night, and I walked into a place and there were several family groups around. One of them had a birthday cake and there were several children with them, and I knew they were all related and they were standing, very close together. But then once I walked into where the hostess desk was, the only people that were in there, and there were probably 5 or 6, were very well distanced from each other. So, all of the language in the Healthy at Work says, or not all, I shouldn't say that. Most of it is worded such that it's a recommendation and a strong suggestion, but it's not a mandate, right? And so that's good and bad. It gives the restaurants, I guess, a little room to translate what works best for their operation. But hospitality is tricky, because if you tick off, someone in a party, then you may be losing a customer for life. And right now they're fighting for their business lives, and they don't want to upset anyone. So I know that's not a very good answer, but
no, I can understand.
I think that calling ahead is probably the best way to get answers and maybe to avoid potential issues. If you call ahead and ask questions and say, what's your policy on that? Or I want to specifically sit in, XYZ area because I know your space. I'd really like to be as far away from other parties as I can be. And just ask questions. You'll get a feel for, for what their policy is and how they're trying to train their people. The other thing is, a lot of their people have only been back on the job for a week. And as much as they probably have stressed some of or most of the points, if not all, of what's new and what looks different, it's all new to them.
Yeah.
They're having to do a lot of things more frequently than maybe they did before.
Mm-hmm. Thanks, Stacy. I've got one more question, Justin, then you can continue. This one is for Dr. Furman. And the question is, where can I get tested, and will there be an insurance or out-of-pocket charge for that?
Yeah, I can speak to U of L Health testing, but then the governor's website has all the other specific testing. And throughout the whole state, Kroger's doing testing, and Walmart and different places are doing testing. But at U of L, our testing is at 499 South Brook Street downtown. It's about a block away from U of L Hospital. So it's where the old, there was a Jewish building there. Now it's U of L Health Medical Plaza 2. It's like in their parking lot. And it's just a drive-through testing, but you have to have an appointment. So you have to call ahead, and all the U of L practices can make an appointment for you. But if you don't have a PCP and you want to be tested at that site, they're doing like these just quick new patient appointments to get you scheduled. So you can call our office at the 588-4340 and say, you want a COVID test, and we can get you set up for a quick screening appointment, and then through our access center, and then get you an appointment time. But the governor's website has throughout the state where you can be tested. The insurance, it just depends. The governor's ones that they've gone throughout the state, my understanding, those are free. But you just have to call each site. But the big thing is that you should never pay cash, for any of these testings. So some of these testings are scams that are set up. So your insurance will cover it, or sometimes these sites are just free based on the governors and the infrastructure they have in the state to pay for this testing. So was that answering the question?
Yes, thank you. Okay, Justin, it's on you now for the rest.
Okay, so I'm assuming that's the University of San Diego has shared research indicating that COVID-19 likely has aerosol transmission, meaning that these aerosol particles can take hours to settle. Given this information, are there additional precautions we need to be taken when we're in public spaces, especially restaurants, when people are staying in a public environment for prolonged periods and not wearing masks while eating?
Is that for me?
Yes.
I can answer
Okay.
some of it, and then Stacy, you can answer
Okay.
some.
So as far as extra precautions other than masks when you're out in public, I don't know what else would be advised. I do know that, and I think this may answer a later question as well. Someone asked about Servsafe training. Servsafe training covers a lot of the facility, but when the health inspectors come in, and they come in at a minimum twice a year to check, they'll spend a few hours checking every possible part of the restaurant, right? Including, but not limited to, the HVAC system. So those things are checked regularly. Now, not every business probably has the same schedule, and some may be more, oriented to having it checked when the weather changes or at the first of the year or whatever. But those things are checked on a regular basis, and the health department does monitor that. There has to be one person at all times whenever a restaurant's open that's designated the person in charge who has that training, right? Whether it's the health department training or Servsafe training, someone in that space that's on the premises has to have had that training.
And the other thing with the mask, and the spray, I think everybody's been talking, okay, it's droplet transmission, and now it's like, okay, this is aerosolized transmission. So it's a little bit kind of the same, but basically aerosolized means, a spray comes out. And I saw the link there that you gave, Andrew. That was interesting just to look at that article really quickly. Let me just look. Yeah. So anyway, the big thing is that's the reason, because you can be asymptomatic and be spraying it and not knowing it. So that's why you're always supposed to wear a mask, because maybe you have it, maybe you're asymptomatic and you have COVID, you don't want to transfer it to other people. And then wearing the mask kind of protects you from getting it, but not so much. Really, the reason to wear the mask is to not spray everybody, with your aerosolized COVID. So, but that's the reason why at a table in the restaurant, or whenever you take off your mask, you put it in a paper sack. But that's the reason, like, the people close to you have to all be in the same quarantine group that you've been quarantined with, because, you've already exposed that group. You don't want to be taking off your mask and be close to people. So if you're going to take off your mask, you have to be 6 feet away. So, people are going to eat independently at a table, but if they've been quarantined together, you can take off your mask and be together at a table. So that's the big issue at restaurants, is taking off your mask. And that's why, I agree with you, Stace, and everybody else. It's like, if you're going to a restaurant and no one's wearing the mask, just keep on going, go to a different restaurant, or call ahead, like you said. And it's like, are you enforcing the policy? Are you using the policy?
Mm-hmm.
Can you speak to the concerns with air conditioner systems and the circulation of air in restaurants, which can be problematic as it spreads COVID-19?
I have heard nothing about that, and I apologize. I just am not well-versed on that. I think, as I said before, restaurants, just like most businesses, have agreements with HVAC companies that regularly service them. And so I don't know, it depends on the size of the business. It depends on the age of the system, I'm sure. It depends on the ventilation. That is not my area of expertise.
Yeah, and I think the ventilation is, like you said, at all these doctors' offices and the hospitals have like isolation rooms with specific ventilation. That's where the COVID patients are kept. But just the general population, there's not specific ventilation, I don't think, for restaurants or doctors' offices or any place else.
Right. Yeah, any business that we go in, I would imagine.
So someone comments they've already seen restaurants in different parts of the state, including locally, who are not adhering to social distancing as well as masks. Should they be reported, and then what are the consequences?
Well, it's recommended that people wear masks when they're not eating, but again, if you read the language, it doesn't really say that. It says restaurants have to come up with their own policy on that, and so there's a place on the Healthy at Work website where businesses that aren't complying or people that aren't complying can be reported. You can always call a health department and ask them to do a follow-up. But if that's not the restaurant or the business's policy, I don't know that anything will happen to them.
So let's see, I work with senior living communities that operate with restaurant dining programs in their residencies. Currently, they are having to deliver meals to resident rooms. If these communities institute restaurant guidelines, can these dining rooms submit their plans for serving to the governor in attempts to reopen these to residents?
That's a good question. You know, I have to be careful what I say. We haven't gotten a lot of feedback from the governor's office. We didn't get any comments back on our plan. They just posted their plan. So I would assume that, and I know the gentleman that heads up the Senior Living Association, I would assume that they're working very closely with Healthy at Work, you know, as closely as you can work with that group and trying to get those things to happen. But as we've seen, so many of our COVID cases have come from environments, you know, where groups live together, whether it's nursing homes or senior living, you know, groups, whatever, that I guess they're just taking extra precautions. I don't know what process they have to go through to be approved for residents to come and dine in dining rooms. I don't know when that happens, if they're just waiting for the number to be lifted from groups of, you know, 10 to groups of 50, which I think is July 1st. I don't know what they're looking for.
And this is Christian Furman. So yeah, Joy, I think that's a good point. The governor's task force has been discussing that, you know, and I think it's different for like the nursing home versus personal care versus assisted living versus independent living. And, you know, I think some personal care now are even having the communal dining, but everybody's 6 feet apart. So, you know, some of those, I don't know if that's the official guidelines of this. Some of these communities are just doing it on their own. And what you said, you know, there's patios and balconies where they could eat outside or really be far apart with their eating. So I think that's what the group's looking at, is just making it 6 feet apart. So, but I'll ask today at our meeting. We have it every Tuesday at 2. So it's always good that we have this at 10 o'clock, and then at 2 o'clock I can bring it to the group and see what those guidelines are going to be. And I think it's probably going to be a phased approach, like assisted living, personal care. We'll probably do something maybe before long-term care. We'll do it.
So Joy suggests that maybe the KRA can work with the governor's task force on developing guidelines.
I would love to, but there isn't a task force. So we submitted our proposal, as I said, as soon as that option was available to us. And the gentleman that I communicate with in the governor's office as deputy chief of staff, you know, I follow up with him, and I wanted to be on his radar every other minute, you know, and try and maintain conversation. But he couldn't let me know that they had the proposal that we submitted. As I said, the guidelines that they came out with, I thought we would see them first and have a chance to comment, but we didn't. They were just posted to the website on a Thursday evening at 7:30 without any warning. And so I was, you know, we had to scramble and try and figure out how to translate everything to relay to our members all over the state. You know, it's been frustrating. I was asking from the minute all of this started in March, I asked to be part of a task force or an advisory group made up of industry so that we could help, you know, formulate the guidance and answer any questions along the way. as they were discussing reopening when that took place. Many other states have done that, and that just never happened here. So we feel like we've kind of fallen on deaf ears. I would love for there to be a task force. And even if I'm not on it, I'm not the end all be all person. Even if we had restaurateurs that were willing to serve in that capacity and advise the administration on, issues specific to our industry, that was my wish, but that just didn't happen.
But Stacy, I'll bring that up. I'm on the long-term care task force for the governor, the COVID task force for long-term care. And yeah, we maybe having you as a guest, to help us figure out the opening policy for like personal care, assisted living, long-term care. So I'll bring that up.
Okay. I'm open to anything. It's been really tough getting bits and pieces of information. I feel like, and I've said this multiple times over the past 2 or 3 months, I feel like the governor's office feels like industry is on a need to know basis, and we don't need to know. They'll do what they're going to do when they do it, and they don't really want our input. When we've asked questions, when we got the guidance, and I said, why didn't we get to see this first before, our members are seeing it the very moment that we are, and we're getting questions we can't answer yet. And the response I got was, well, if you have comments, you can still submit them. So when I did submit comments, the answer I got back was, we're sticking with our original language. So it's just been frustrating. Whatever you want to put in word-wise for us, I'm good with.
Okay.
Thank you.
This is probably a question for Dr. Furman. Considering the many risks that still exist with COVID-19, would you recommend that older adults continue to do takeout rather than sit in a restaurant environment?
Yeah, I'm always thinking that where we are now, like everybody knows the rules, everybody knows the information. It's almost like individualized decisions about everything because, it depends on the older adult. I mean, all older adults are immunocompromised just based on their age. Over the age of 65, people are more immunocompromised, but some just have their age and that's it. But others are like on medicines that make them immunocompromised, have medical diagnoses that make them more immunocompromised. So the more immunocompromised you are, the more you should take precautions. And anytime you're out in the environment, you're at risk. So it's safest to be healthy at home. And if you can stay at home or have other people go out and do your shopping or other people do, bring you food, that's the best. But then you're always weighing the physical health and your mental health. And so sometimes mentally, people do need to get out. But I would definitely go to one of those restaurants that's practicing all the proper protocols, wearing the mask, staying 6 feet away, and making sure you're isolated at your own table, and maybe bring your own wipes. I think that's great that your husband brings his own wipes, bring your own wipes. And it's okay to take all these extra precautions. I mean, everybody has to be responsible for their own health and their own body. So yeah, you should definitely have an individualized approach, and geriatrics is all individualized. It's not one size fits all. There are definitely people that are more, have more conditions than other people. So yeah, I think everybody still, even though this was on the news, just because you can do all these things doesn't mean you should do all these things.
Right.
And you should limit your exposure. So don't get your hair done, get your nails done, go to the grocery, go out to eat, go to the, go shopping all in one day. That's like 5 exposures. Like maybe just 1 exposure a day or 1 exposure a week, depending on your risk. So it's when all these exposures add up that people actually get the virus. So, and get symptomatic from the virus. It's your viral load that makes you symptomatic. So, your body every day is probably exposed, but it can handle it and it can deal with the virus. But if you have more and more and more and more exposure, your body just gets overwhelmed. So definitely limit your exposure as much as you can. Be strategic, be thoughtful, figure out what gives you the most pleasure, the one thing, and just do that one thing first. And then, plan your day and plan your activities.
Mm-hmm.
Stacy, are there any special precautions that food service companies that provide products to restaurants are taking?
Yes, I think I think most every business is taking precautions regardless of whether you're in the restaurant world or not. But companies that make deliveries to restaurants are not only taking their own precautions, you know, whether it's gloves or masks or all of the sanitizing precautions that they have to take in their facilities and in their delivery vehicles and with their drivers, but also restaurant folks are required to, not required, I guess I should say recommended, to monitor those things that are coming into their business as well, right? And, you know, and to call out drivers that maybe don't have gloves on or don't, you know, aren't meeting that restaurant specific policy on face coverings or temperature taking. You know, I know a lot of restaurants are taking temperatures of anybody that comes into the building, and you know, it's again, it's food safety, so a lot of those precautions are already built in, but I think that a lot of what we see looks different, you know, because of the face masks and because of gloves or you know, anything that we can visually tell looks different.
Okay, and then there's just an acknowledgement from Joy, who's a former restaurant worker, that she appreciates your input and as a former employee, she understands your frustrations, and she just acknowledges the benefits of restaurants being from social, nutritional, economic, and then many other areas.
Thanks, Joy. It is. It's like in Louisville and in Kentucky, I feel like restaurants are part of our entertainment dollar. You know, it's just such a thing for us. I think that's why we've got such a great cross section of diverse and ethnic restaurants here. You know, Sullivan University and other hospitality, you know, Western has a great program. They all contribute to what has become a scene that other cities envy in Kentucky and in Louisville. And you know, it's hard when you're not able to kind of go visit your favorite places because you get attached to the people that are there, you know, I mean, and I know I do because I'm in and out of them all the time, but, you know, everybody has those couple of places that, you know, they feel like their family, or, you know, you keep up with, you know, the hostess or whoever, you know, we're very relationship driven. And I think that restaurants feed a part of what we need, you know, even if we're introverts. You know, you get that kind of feedback when you go out to eat, you get great food, you know, even if it's just picking up a carry out or you know, seeing a delivery person, just makes you feel good.
Thank you, Stacy. If there's no other questions, I don't see any other questions in the chat, but if you still need to ask a question, you can type it in the chat right now. Oh, there's one from Justin. Go ahead, Justin.
I'm just reminded that if you or anyone you know is providing care to a loved one who is older than 60, the Traeger Institute has a caregiver program, and our contact information is there as well as on our website.
Thanks, Justin. I just want to also acknowledge that this morning we had a little Zoom bombing happening during the session. We want to make sure that you all know that we have a dedicated staff tracking it, and it was removed immediately. We apologize for the inconvenience. We took your safety very seriously, and we were able to control the situation. But if you have any questions or concerns, you are welcome to email us. And I want to share with you a few of our upcoming sessions. We're going to start talking about the reopening of health. We want to talk about some of the systemic issues in healthcare that became very apparent during COVID-19. And we're going to also talk about some positive changes that came because of COVID-19, specifically in related to how we engage with technology, and then a little bit also talking about the social isolation of older adults. If there's any other issues or things or topics that you would like for us to discuss, feel free to contact us. And thank you to our team this morning for helping us to have a great session. And we hope to see you all again next week. Thank you so much.
Thank you all.
Wash your hands.